There is light in my lady's house, and there's none but some falling rain. Less like a spoken word.
Hello and welcome. The following film is presented to you by A&S Wire and is based off the true story of Henrietta Lacks. We will see themes of patient interaction with doctors throughout this film. The scene is set in the 1950s in an exam room at a hospital. A white woman patient was just diagnosed with cervical cancer by her doctor. This is a dramatization of what would actually go on in an exam room with a white female patient in the 1950s. Viewer discretion is advised.
This is Jane Doe. I'm Dr. Wade. I have some forms I'd like you to sign.
What kind of forms?
This form authorizes us to put you under anesthesia and use any specimens during the surgery for research purposes.
Excuse me?
This form authorizes us to put you under anesthesia and use any specimens collected during surgery for research purposes.
Just sign here.
In a traditional hospital setting, the nurse would aid the doctor. The nurse would typically go over procedures and other things to help clarify for the patient. In this particular setting, the nurse helped clarify some benefits. This is the nurse.
Will I receive any benefits from this?
You're not. There's a. You're not. I mean, it's complicated because you can't like if you sign the form technically. I mean, if you sign the form, we have to there's a procedure we have to go through the IRB, and there's like things we have to go through, and it's like I can't even begin to describe you what we have to go through. Like when we take your organisms, it's like you're technically doing it for the greater good. You're helping other people. You're helping other people, and they're gonna help you, and it's gonna help everybody. And it's transit property, zeros, numbers.
Seriously!
No.
Well, I don't really want to be a part of that.
Anything. We're just rattle up.
So explain to me what just happened.
She didn't consent to us taking her cells for surgery.
So technically, what she's saying is, she didn't consent to us taking her cells for surgery.
So technically what you're saying is you couldn't take her cells during surgery for research.
Yeah, so technically we can't take her cells for research.
Right. Like so, when we are doing surgery, we cannot take her cells for research.
So what we just saw was a doctor and nurse trying to get specimens from a patient, but were denied. So basically, they can't take any of her cancer cells for research during surgery because that would be illegal. Denied.
Denied.
Now this is our interpretation of what happened to Henrietta Lacks in the hospital with regard to her consent and surgery consent forms. January 29th, 1951, Henrietta Lacks went to go see her doctor at Johns Hopkins Hospital. She went because she felt a knot on the inside of her cervix. Little did she know that was cervical cancer. She went to Johns Hopkins because that was the only hospital in the area that would treat black patients. Because of this, doctors often exploited black patients for research. For example, Henrietta Lacks did not receive the same consent forms. As you can see, the doctor is only giving Henrietta Lacks the surgery consent form. Unfortunately, black patients didn't receive the necessary education for them to be able to read the consent forms. In Henrietta's case, she only consented to radium treatments.
Miss Lax,
Yes.
I need you to sign this consent form for us to perform the radium treatments on your carcinoma.
Okay, I'll sign the consent forms for you to perform surgery.
But she didn't consent for him to take specimens during surgery. And that's not legal or cool.
My name's Henrietta Lax. I went to Johns Hopkins Hospital to get treatment done on my cancer. Those doctors over there told me they were only going to remove my
Name's
tumor.
Dr. Guy. You may be acquainted with my twin, Dr. Wade, from a different hospital. Not related, just twins. We look a lot alike. A couple days ago, radium treatments were performed on a patient. I don't know her name. All I know is that prefix he and the prefix LA, because I have her cells. I requested that the surgeons acquire a sample of HeLa's cells. HeLa's cells are the first cells I've ever had that have grown at this rate. This might lead to the first immortal human cell line. It's impressive. I told the surgeon to send me cells whenever possible from this HeLa patient. I can only assume they gave her the informed consent for research.
Allegedly, Dr. Guy did talk to Henrietta Lax about the research. But no one knows if that's true. But if it was, this is what it would look like.
Oh, my cancer! Oh, doctor! The cancer! My cervix. Oh, my cervix.
Mrs. Lax,
Yes.
my name is Dr. Guy. I want you to know that we've taken your cells for research.
Wait a minute. You said what?
We've taken your cells for research and you're going to help a lot of people.
Oh my, wait a minute. I didn't agree to that.
They're growing infinitely. You're going to help a lot of people and do great things. You'll
What?
save lives. You'll save millions of lives.
But wait a minute. Did I consent to that? Well, as long as I'm helping people, that is just okay with me.
Perfect.
Nice.
So, nurse, it's my understanding that you're an assistant to Dr. Guy. Is that right?
Yes, I am an assistant to Dr. Guy.
So, did Dr. Guy really ask Henrietta Lax for consent?
I mean, I didn't see him, and none of my nurse friends saw him, and no one else saw him, but, I mean, I don't know, maybe.
So there you go. Nobody really knows if Dr. Guy really asked Henrietta Lax and she said that it was okay to do research on her cells. So in conclusion, Henrietta Lax was never given the informed consent forms for research. She was treated unfairly compared to the white patient who received treatment for her cervical cancer. The white patient was given an opportunity to consent for research. Unlike Henrietta Lax, who was never given the forms. Thank you for watching our feature film. Join us next time as we explore how does the cookie really crumble?